Now try to move to the next inflammatory condition, and this is what is known as the necrotizing fasciitis. Necrotizing fasciitis. So necrotizing just simply means what? Tissues are dying off. Okay, tissues are dying off. It could be due to infections, or it could be due to the blood supply is being cut off. So necrotizing fasciitis is that it's a rapidly progressive, it's a life-threatening soft tissue infection, and it primarily affects involves the fascia and the subcutaneous tissue. So it leads to a lot of tissue death. Okay, so it's often referred to as flesh-eating disease. So pathophysiology is caused by polymicrobial infection. So you're having all those group A Streptococcus infections, or mixed infections with other bacteria. So the bacteria will now be releasing toxins and enzymes. Those are the ones that will now be eating up your flesh, so to say. They are destroying the flesh there. So rapid spread along facial planes due to poor blood supply in these tissues. So it leads to all those systemic toxicity and sepsis if left untreated. So early signs is a lot of pain there, swellings and erythema, progression, and now leads to all those skin discoloration, bullae, blistering, crepitus where there's gas in tissues, and now the tissue health to be deteriorating. Okay, so systemic issues can be having fever, tachycardia, hypotension, confusion, septic. This is mostly when the infection has tracked into blood and has spread to the different systems. Okay, so diagnosis, first of all, used by seeing the wound you are suspecting. Alright, they do all those x-rays, CT scans or MRI, which will show gas in the soft tissues. They do lab tests where you are trying to look at the levels of white blood cells, levels of C-reactive proteins, metabolic acidosis. Treatment is they debride the tissues that have died. Okay, then using broad spectrum antibiotics, then intravenous fluids, vasopressors if needed, then also the hyperbaric oxygen therapy.